Namaste. Welcome to Sushrutha. I sincerely thank for giving us the opportunity for your eye surgeries. I reassure you that at Sushrutha, we provide state-of-the-art eye care with the most modern technologies and still at very affordable prices. The short video that is going to follow will give you all the instructions regarding the post-operative care following intraocular surgery. Please follow all the instructions without fail. I assure you of a very rapid visual recovery. Thank you.
Sushrutha Eye Hospital. Post-operative care after cataract surgery. Vision recovery. The time for vision recovery varies from patient to patient. A few may be able to see almost immediately. Others take days or weeks for the vision to restore. The speed of recovery following uncomplicated surgery depends upon the patient's healing ability, density of the cataract, size of the eye, amount of inflammation or edema that develops after surgery, and host of other factors. Your best vision can restore only after wearing the spectacles for residual refractive error for distance and near. Post-operative protective goggles are given with the kit. Patients are advised to use them for 15 days. After 15 days, refraction will be done and suitable glasses for both distant and near visions for reading are prescribed. If the surgery is done by phacoemulsification, new spectacles will be prescribed after 2 weeks. If the surgery is done by ECCE method, change in glasses is recommended after 8 weeks, sometimes after removing sutures. Redness. Itching and watering are normal during the initial post-operative period. Do not rub the eye. These problems will reduce as the days go by. Sometimes glare and drooping of the lid is also seen. Alarming symptoms. In case of any increase in pain, decrease in vision, or injury in the operated eye, contact the hospital immediately. Medicines. You have to instill the medicines compulsorily as written in the prescription. If you don't understand the instructions clearly, please ask the assistants and clear your doubts. You should always use clean cloth to wipe the drops of medicine that come out of your eye. Alternatively, sterilized cotton can be used. If you are suffering from other diseases like diabetes, cardiac illness, blood pressure, asthma, etc., you can continue the concerned medicines. If any other health problems like headache, cold, vomiting develop in the post-operative period, you can consult the concerned family doctor and take medicines as prescribed by them. Please apply post-operative medicine only up to the time prescribed. Do not continue the eye medication beyond the prescribed date even if some amount of medicine is still remaining. How to apply eye drops. Wash hands with an antibacterial soap. Remove the seal and tighten the cap for making hole in the bottle. If it won't work, pierce with a hot pin to make a hole on the top of the bottle. Tilt your head back and look at the ceiling. Gently pull the lower lid. Squeeze the bottle to release a single drop into the eye. Take care not to touch the eye or eyelid with the nozzle of the bottle. Release the lower lid and close your eyelid for 2 minutes. Dab excess drops with tissue. In order to prevent contamination of the eye drops, do not allow the nozzle to touch your fingers or anything else. Do not allow other people to use your eye drops. Replace the cap of the eye drops immediately after use. Discard the eye drops after 4 weeks of opening. If you are using more than one kind of eye drops in the same eye, wait for 2 minutes between the drops. If you are using both the drops and ointment in the same eye, always use the drops first and wait 5 minutes before applying the ointment. What are the other precautions to be taken after surgery? Use the eye drops and medicines as prescribed. Avoid rubbing or squeezing your eye. As advised by your doctor, you must wear the protective eye shield at night for first 2 weeks while sleeping. Protective goggles may be worn during the daytime, especially outdoors, to avoid any discomfort that you may have from dust and wind, and also to prevent any injury to the eye. You can wear old spectacles if the vision is still okay with them. Do not lift any heavy objects. Do not bend down or sleep on the side of the operated eye for 1 week to avoid pressure on the eye. Stay away from children for 4 weeks. During the first week, avoid splashing water directly into the eye. Sterilize a handkerchief by immersing it into boiling water for 3 minutes. Once the water cools, wash your hands with an antibacterial before you take your handkerchief out. Once your hands are clean, take the handkerchief and squeeze out all the excess water from it. Mop clean the surrounding area of the operated eye. You can brush your teeth from day 1 after surgery. Shaving is permitted after the operation. Body bath below the neck can be done even from the first day. Avoid water getting into the operated eye for 1 week. Regular face wash can be started after 1 week. Head bath with oil can be taken after 1 month. Normal daily activities like walking, reading may be resumed 1 week after the operation. However, avoid strenuous activities like jogging, lifting weights, gardening, etc. for 4 weeks. You can resume your sex life a week or 2 after the operation. Avoid eye and face makeup for 2 weeks. There are no dietary restrictions and you may take your routine diet. However, the precautions related to your general condition are to be followed. You can watch TV from day 1 of surgery. Light housework, including cooking, can be resumed from day 1. However, please wear your protection glasses while working. Washing clothes by hands and cleaning the floor should be avoided. Office or business work can be resumed after 1 week. You can normally comb from the day 1 after surgery and also use hair oil for combing. Avoid driving for the first few days. Journey. If necessary, after 1 week you can travel, but be careful to avoid injury and dust. Do not forget to take medicines along with you. You may get back to your job in 1 or 2 weeks after surgery depending upon your profession. Ask your surgeon about this. Practicing yoga or performing exercises which pressurize the eye should be avoided for 4 weeks. If you have not understood any of these instructions or if you have any other doubts, feel free to clarify from the hospital staff. We are really thankful to you for watching this program attentively. And we wish you a rapid visual recovery.